Hello, I'm Rob Shaw, and I'm here today with Dr John Dickson, a GP with a special interest in musculoskeletal diseases, in particular osteoarthritis, and until recently, the clinical advisor to NICE for the OA management guidelines. He co-founded the Primary Care Rheumatology Society and is here to talk to us about a new treatment for the pain and stiffness of osteoarthritis, Flexiseq. So John, what is Flexiseq?
Flexiseq is a drug-free topical gel to be applied to painful and stiff joints. The commonest joints affected are the knee, hand, shoulder and hips. Being drug-free means that it has none of the risks of the existing drug treatments. It's got no drugs in it, so anyone can use it, whatever other medication they're on.
What does Flexiseq do?
It's a gel that works for both pain and stiffness. And there are quite a lot of patients that actually only have stiffness without the pain.
How can patients ensure the best results?
I'm glad you asked that question because, again, it's different. It needs to be applied to the joint and not rubbed in. In my case, I actually use it on my hands. This one, of course, is the wrist joint. And try not to have too many areas that have got a thick layer. I also like it on this joint, but again, if you notice, I'm not putting it on the bone. I'm putting it above the bone and below the bone. So if you're putting it on a knee, you shouldn't put it on the kneecap. And it's applied and left to dry. It's not rubbed in. And of course, waiting 10 minutes can be hard work, especially if someone's nagging you to go and do the washing up. So I take a hairdryer and dry it. If you're not using a hairdryer and the drying takes longer than 10 minutes, you've actually applied too much. And that's wasteful.
When should patients expect to experience a benefit?
Again, it's very fast acting in that it only takes 2 or 3 days to work, and usually most people have had some satisfaction by 5 days. So it is essential that people expect to have to wait a few days before it works.
So does Flexiseq have any side effects?
Flexiseq has very few side effects. Importantly, it has no systemic side effects that most of the oral medications that people try to take. So it doesn't have cardiovascular side effects, it doesn't have gastrointestinal side effects. A few patients get some skin irritation, which usually passes very, very quickly.
So what about the side effects of other topical treatments, such as topical NSAIDs?
There's a systemic effect of most topical medications. The uniqueness of Flexiseq is that it doesn't go into the bloodstream.
So can you tell us a little about which patients can use Flexiseq?
It's a medication that acts through a mechanical lubricating action. So people that are taking oral medications for their arthritis are often contraindicated to taking these oral ones because of their diabetic problems, their cardiovascular problems, and quite a lot of other diseases. So this one can be used with whatever problem you've got, and it's most unlikely that they'll have any side effects.
So where can patients obtain Flexiseq?
It can be obtained from all pharmacies, and in fact also from online pharmacies.
John, thank you very much for talking to us today. I hope that answers all your questions. If you do have any more questions, please visit the flexiseq.com website for further information.